here to talk to you today about RoboDocs, a for-profit company that will use AI to render primary care physician services that is personalized and convenient. The reason I came up with the idea of RoboDoc is because I come across complaints about access to primary care physician both in my personal life as well as my professional life. In my professional life, a lot of times we get complaints from patients that it's extremely hard to access primary care physicians in a timely manner. In my personal life, I've come across friends who've had stress-related issues due to work but has to take time off to go see a doctor, which then backs up their work, causing additional stress. At the same time, the way that healthcare experts see one of the best ways to reduce costs that is escalating for the last few years is to improve the access to primary care physicians. But how can that be when, according to StaffCare, there's a shortage of primary care physicians? For every 174,000 physicians that are exiting the workforce, mostly due to retirement, 44% of primary care physicians are over 55. Only 135 or so physicians enter the workforce. And of those entering, there's a tendency to work less hours. So that created a gap that I thought could be met perfectly by RoboDocs. Granted, having a face-to-face interaction with a physician has more human touch, but RoboDoc can provide personalized as well as convenient care, which in the long term will be more cost-effective, something that we will get more into in the budget section. And it also allows for a flow of better medical records, as providers will, as well as the patient, will be able to access their medical records on an online platform such as Office Ally, which can be built into an app that can hold the medical records and can have the capacity to make appointments at the patient's convenience. So who can be interested in RoboDoc? Patients, as well as hospital systems for discharge follow-up, health insurers to ensure that patients meet their HEDIS requirements, such as your wellness shots and your wellness exams, primary care clinics that are having a hard time filling positions due to the shortage, as well as nonprofits such as Doctors Without Borders that can access the RoboDoc to reach geographically isolated areas or areas where it is war-torn. So what's the cost of RoboDoc? RoboDoc is actually a company that will acquire the robots from SoftBank's software, which is a company in Japan. They sell a robot named Romeo for about $325,000. Today I'm here to ask you for $2 million to invest in this company in return for 25% ownership. The way that most of the money will be used, of course, for the purchase of the robots themselves, as well as to develop the app with Office Ally that would enable the patients to make the appointment and access their medical records online, as well as to train the staff and for insurance and travel. In year 2, we hope to expand from 5 robots to 25 robots, with 15 being leased and 10 direct sales, and in year 3, at least 100 robots. The way the cost breakdown is, the lease comes out to about $10,461 for 12 months over 3 years, which comes out to $376,000 or so, which is a 15% markup from the original price. Now, if you were to buy the robot outright, that would be $400,000, which is a 20% markup, but will include the training, warranty, and support, and such things. Why me? I've been working in managed healthcare for 15 years, so therefore I know how to navigate and who to reach in order to make this project successful. And as well as being familiar with Office Ally and how to use it. So, sharks, are you ready to invest? That's all.